Hey guys, how are you? This is Dr. Kim. So today I want to talk about a unique feature of lateral cephalometric radiograph that other radiographic images in dentistry do not have. So here we have a lateral ceph that was taken for patient who was going to undergo an orthodontic therapy. And if you look carefully, the patient has a malocclusion in the anterior maxilla where there's a crossbite, as you can clearly see. I can probably adjust the contrast to bring out the crossbite a little better. And then we see a tremendous amount of anatomic information. Obviously, we tend to focus our eyes a lot on just this area, but just keep that in mind. There are a wide range of pathologies and different conditions that can involve the cervical spine and in the paranasal sinus, and rarely, but it does occur within the cranium as well. The main point that I want to bring out is I want you to take a moment to kind of take your eyes off of this bony tissues, right, bony areas, and then look at the soft tissue density. So try to follow the soft tissue outline of this patient's head and neck. What do you notice about the radial density about this patient's face versus the rest of the scan? So let me try to change the contrast. Okay, I think this is a good contrast to kind of address my point. I don't know, I hope you can see this. There is a faint line down the image that anything in front of that area, the soft tissue outline, is a lot more visible and clear. Anything to the left side, you start to lose the soft tissue outline. It's just not as well visualized. Yes, we can see it, but not as clearly as the patient's front of the face. Let me try to adjust it, lower the contrast to bring out this soft tissue outline as best as I can. Even then, this outline is definitely more clear and sharp. And there's a distinct line that comes down that affects this area. Right? This area should be just air, but it's dark, radiolucent, but relatively fairly radiopaque, even though we're imaging just air. So what's the explanation for this appearance? Well, you have to know that why these lateral cephs are taken. So in orthodontics, there are numerous landmarks along the hard tissue as well as the soft tissue that they trace in order to assess the growth of the patient. Which means it's very important for us to clearly visualize the soft tissue landmark, whether it's the prominence of the lip or the prominence of the chin, whatnot. And these soft tissue landmarks are important. And in order to create the better soft tissue landmark, we actually place a filter within the machine, or I shouldn't say we, but the machine has a filter inside in order to bring out this soft tissue landmarks. So that's actually a filter that you're seeing in order to reduce the intensity of the radiation, hence bring out the soft tissue landmarks better. So in case if you've never known that, I hope this is a clear example of the use of filter and why we do it and how that makes a difference in terms of the image quality, right? So I think this is a very this part is very telling. You can follow the soft tissue very well, and right after this line, it's much more difficult to visualize that line. Alrighty everyone, that's it for me. Thank you very much, and I'll see you in the next video. Take care.